Okay, so hi guys. Yes, so today, thank you Aditya. Thank you so much for this. And so today we are going to discuss a very short topic, a very small topic, but a lot of updates in this topic. So it's super important. So this topic is just your Hamartomata polyp. So what do you understand by the term Hamartomata polyp? So guys, whenever it is a university question, you should know what do you understand by hematoma. Hamartoma starts with the word H. Okay, so it starts with the word H. That means it is haphazard arrangement of the tissue. So whenever the tissues are haphazardly arranged, it is Hamartomatous polyp. Okay, so what do you mean by haphazardly arranged? So normally, whenever we are talking about intestine, there is a layer which is arranged. Okay, so there is mucosa, submucosa, muscularis, and serosa. That's how the arrangement is there. Okay, but when the arrangement becomes haphazard, that is a problem. So that is what is called hamartoma. And when it starts projecting out and become a polyp, that is a hamartomatous polyp. You understand that? So hamartomatous polyp means something which is haphazard arrangement of the tissue. Okay. So good evening, Gopi, and good evening, 𝗏𝗏𝗃𝗏, right? Okay. So that is your hamartomatous polyp. Okay. So once we are very clear with this, now let's understand what is the hamartomatous polyps of the intestine. Okay. So whenever I'm talking about the intestine, let me talk about a case, okay, which is a very common case, okay, before we go to the, the types, okay. So let us say this is an 11-year-old female started, okay, presenting with an abdominal pain, okay. And when you looked at her, there was some pigmentation on her lips, okay. So there was some pigmentation on the lips, okay. And later on, she was found to have intussusception, and there was a polyp which was taken out from her jejunum. Okay, so this is one of the manifestation of a hamartomatous polyp. Second manifestation, second case, let me talk to you about it. So this is a 5-year-old child presenting with rectal bleeding. Okay, so 5-year-old child presenting with rectal bleeding. And when you did the examination, you found there were multiple polyps in the rectum. When you resected it, okay, so you found out that some of the polyps were showing abnormally dilated gland. So this is also a hamartomatous polyp. You understand that? So hamartomatous polyp means whenever there is haphazard arrangement of the tissue. So what is haphazard in this polyp? So there are cystically dilated glands, which should not be there. Normally glands aise hone chahiye, so they should be perfectly rounded like this. But when they become cystically dilated like these, this is not normal. This is abnormal. So this is an abnormal arrangement. Okay. So similarly, look at this polyp again. So when you look at this polyp, normally when you look at the intestine, we have mucosa, we have submucosa, we have muscularis, and then we have serosa. That's an orderly arrangement. But suppose now what happens is that muscularis and, okay, so this muscularis and the lamina propria, okay, so normally, whenever we talk about mucosa is made up of three things: epithelium, lamina propria, and muscularis. Okay, so what happens is muscularis and the lamina propria starts growing and it starts dividing, arborizing. Okay, so when they start dividing like a Christmas tree, okay, so when they start dividing like a Christmas tree, this kind of a polyp is a hamartomatous polyp, because normally it should be arranged like this, but here the arrangement of the muscle and the lamina propria has become altered. So when you see this muscle, okay, dividing inside the polyp, muscle and lamina propria dividing inside the polyp, this is hamartomatous polyp. Everybody clear with this? Okay, so with that basic introduction, let us go quickly into the types of hamartomatous polyps. So for all practical purposes, we have two basic type of hamartomatous polyp. One is called as 𝗬𝗁𝗃𝗏 syndrome. The second is called as juvenile polyposis, okay, or juvenile polyps. Okay. Now, whenever I'm talking about 𝗬𝗁𝗃𝗏 syndrome, so whenever you're writing about this polyp in your second year, you should first write down, always go and remember in a systemic order, what is the cause of this polyp. So majority of the polyps, okay, can be sporadic or they can be familial. Okay, so usually So whenever I'm talking about 𝗣𝗁𝗃𝗃 polyp, 50 to 60% of them are familial and they have mutation. Okay, so there is a mutation of a tumor suppressor gene, which is called as STK11, which is called as STK11. Very good, 𝗪𝗫. So this is STK11 gene mutation. Please remember, whenever you have STK gene mutation, this is a very, very important tumor suppressor gene because it controls a pathway which is called as AMP pathway. Okay, so this AMP pathway. So this is a recent update. Please remember this. It controls AMP pathway. What is this AMP pathway? This is the pathway which controls your energy. Okay, so anabolic metabolism. It controls your anabolic metabolism. Okay, so this is the gene which controls your energy. So what happens in 𝗣𝗁𝗃𝗃? There is deletion of STK11. Okay, so when there is deletion of STK11, what is going to happen is this anabolic metabolism is not properly maintained. There's nobody to control the energy or metabolism, and the muscle and the lamina propria start growing aberrantly. So they start arborizing and forming polyp. Understood, everybody? So that's the cause of polyp in the 𝗣𝗁𝗃𝗃 syndrome. Now, what is the cause of polyp in juvenile polyps? That also we should understand here. So here also there is a mutation in a tumor suppressor gene called SMAD4. So this SMAD4 basically is a tumor suppressor gene which controls TGF-beta pathway. So whenever there is a SMAD4 mutation, so there is abnormality in TGF-beta which causes mucosal hyperplasia. So mucosa starts growing, and it starts growing aberrantly. So when it is growing aberrantly, it starts forming cystic spaces. It starts forming large cystic spaces because it's growing aberrantly. Okay, so it forms large glands and which are cystically dilated. Okay, so that's the mutation of juvenile polyp. Okay, apart from that, there is a recent gene which has been found here. This is called as BMP. Okay, bone morphogenic protein receptor 1. Again, this is another mutation which is found in juvenile polyps. Okay, so these again juvenile polyps can be sporadic. So whenever they are sporadic, they are usually single and they are always present in the rectum. They're usually present in the rectum. When they are sporadic, they are usually single and they are in rectum. They are called as retention polyps then. But when they are familial, that is, they have the mutations which are involved here, SMAD4, BMPRN, then they are in hundreds to thousands in number, and you will require colectomy. You will have to remove the colon to make the patient better. ठीक है, so usually juvenile polyp जो होता है कहाँ होता है, rectum में होता है, and patient presents with bleeding from the rectum. So name itself is juvenile. So juvenile naam, it's a misnomer, usually occurs in a child less than 5 years of age. Okay, so usually occur in a child less than 5 years of age. That's a classical clinical feature here. So a child less than 5 years of age presenting with a rectal polyp, and this was also your INI-CT question, so you have to remember. In contrast to this, 𝗣𝗁𝗃𝗃 name itself says PJ. Okay, so it occurs usually in the small intestine, with jejunum being the commonest side. Okay, so they have the jejunum, and they usually are present in the age group of 11 to 22 years. So the age group is 11 to 22 years. Okay, so this is one line here, so it is 11 to 22 years. That's the age group for 𝗣𝗁𝗃𝗃 polyp. Now, since these polyps occur usually in the jejunum, the majority of them will present as intussusception. So what is the problem that they present with? They present with intussusception. Whereas juvenile polyps usually present with rectal bleeding. Okay, so they present with bleeding. So that is why juvenile polyps are usually presenting with rectal bleedings. Okay, whereas 𝗣𝗁𝗃𝗃 usually present with intussusception. So that's a clinical feature that you should be very, very clear with. Okay. So now once we clear with the gene, remember, so what have you started? You've started that 𝗣𝗁𝗃𝗃 syndrome has STK11 deletion, and juvenile polyp has the mutation of SMAD4 and BMPR1. Now, another thing that you have to remember here is that Hamartomatous polyps are usually always associated with extra-intestinal manifestation. ठीक है, इनमें extra-intestinal manifestation जरूर होती है. ठीक है, so like, what are the extra-intestinal manifestation in 𝗣𝗁𝗃𝗃? So remember, it starts with the word P. So P is for pigmentation. So they usually present with pigmentation. Okay, thank you, 𝗏𝗏𝗃𝗃. Welcome from Kathmandu. Good, welcome. So there is usually pigmentation, which you see here. Okay, so this pigmentation is usually in the oral mucosa like this. Okay, so the patient presents with the pigmentation, which is pigmentation can be in the oral mucosa, it can be in the rectal mucosa, it can be anywhere in any mucosal surfaces. You have to identify this. Okay, so they usually have pigmentation. Jabki juvenile polyps usually, so again I told you juvenile polyps is J. So remember they have J-like junctions. So what is this J-like junctions? So they have atriovenous, okay, malformations. They have AV malformations, or they can have clubbing. They can have clubbing. So either they have J's joints, artery and veins joined together. So they're joints. So AV malformation or clubbing is seen. AV malformation or clubbing is seen here. Okay. समझ में आ गया आपको? Okay. So let's quickly revise what we have studied here. Okay. So let's quickly see the images and revise what we have studied here. So clinical feature. Okay. So whenever we are talking about Peutz-Jeghers syndrome, so usually occurs in the patient from 11 to 22 years. P for pigmentation, J for polyps in the jejunum. And what is typical feature of this polyp? It is like Christmas tree. Okay, so there is arborizing muscle and lamina propria in the polyp. Okay, that's a characteristic feature of Peutz-Jeghers syndrome. Now, what is the characteristic feature of juvenile polyps? So juvenile polyps, when we started, usually occur in a child less than 5 years, presents with rectal bleeding. And when you look at the gross, when you look at the microscopy, there are cystically dilated glands. Okay, so you will see cystically dilated glands. So you should be very, very clear with these. Okay, what are the extraintestinal manifestation? In Peutz-Jeghers, we have seen that they present with pigmentations in the mucosa. Juvenile polyps usually present with joints, that is AV malformations or clubbings. So that occurs in your juvenile polyps. Now the most important question which everybody asks me, are they pre-malignant? Yes or no? Yes or no? What do you think? Are they pre-malignant or they are not pre-malignant? So remember, themselves also, although they were earlier considered as a non-neoplastic polyps, hamartomatous polyp, but recently they have found that these polyps can give rise to malignancy. So Peutz-Jeghers syndrome can give rise to lot of non-intestinal malignancies. Okay, so they can give rise to non-intestinal malignancies. So therefore the screening, if you detect them and if there is any person with Peutz-Jeghers syndrome in the family, screening should start at birth. Screening should start at birth. You have to start screening at birth. And what is the type of disease that they're going to happen is they typically have sex cord tumor of the testis. So if it is a male, you have to start the screening at birth itself, and he might have sex cord tumor of the testis. Okay, or what are the other tumors he can have is later in the life. Okay, so later in the life, he can have again pancreatic cancer. So remember, when you study pancreatic cancer, you will remember that Peutz-Jeghers syndrome is one of the very important risk factor for pancreatic cancers. Okay, so it can give rise to pancreatic cancers. They can give rise to lung cancers and breast cancers, and even they can give rise to colon cancers. So colon, I am going to write in the intestine. Yes, so they can also give rise to colon cancers. So yes, so they can give rise to colon cancer. So although they occur in the small intestine, so they can give rise to colon cancers also. So that is the point that you have to remember in Peutz-Jeghers. So lot of non-intestinal cancer, and later they progress to pancreatic, lung and breast cancers, and they can even progress to colon cancers. Now coming to the juvenile polyps. Okay, so what is the typical manifestation that occur in the juvenile polyp? So again, juvenile polyps, especially when they are familial. Okay, so solitary wala to it is retention polyp, it is not malignant, it doesn't give rise to any malignancy, there's no dysplasia. So remember, can I write it like this? So it can be either solitary or it can be familial. Okay, if it is solitary, there is no dysplasia. There is no dysplasia. So no dysplasia means no risk of malignancy. But if it is familial, then it will have dysplasia, and 50% of them will progress into colon cancers. So look at the rate. So 50% of them will progress to colon cancer. So this is very important and you should always remember that. So yes, they can progress to colon cancers. So this is a very, very important update that you have to remember, that what are the cancers which can occur in these hamartomatous polyps. So is everybody clear with this? So that's the gist of these two polyps. Now there is one condition which is called as hamartomatous polyp syndromes. What are they called as? Hamartomatous polyp syndromes. So what are these hamartomatous polyp syndromes? That is, there is hamartomatous polyp in the intestine, but there are extra manifestations also. So hamartomatous polyp is just one part of the syndrome. Okay, so just one part of the syndrome. So there are a lot of extra intestinal features also in this. So what are the hamartomatous polyp syndrome? So first one that we have is called as 𝗬𝗏 syndrome, and Bunyan-Riley-Равабака syndrome. Okay, very popularly called as BRR syndrome. Okay, so this is a very popular syndrome, and usually we don't study it much. But what is the recent update is that both these syndromes, remember 𝗬𝗏 and Bunyan-Riley syndrome, both of them belong to P10 family. So both of them have mutation of P10 family. So they are called as P10 hamartoma syndromes. What are they called as? P10 hamartoma syndromes. So they are called as P10 hamartoma syndromes. So what is the difference between them and what is the similarity? So both of them have P10 mutation. So the only difference that is there in them is that there is phenotypic differences. Okay, so there are clinical features which are different. Genetically, they have same mutation. Clinical features are going to be different. So there was a post on my Instagram which I had posted. If you would have seen this post, okay. So 𝗬𝗏 syndrome looks like a cow. Okay, so looks like a cow. What does this mean? So what is a typical feature of cow? Cow has, hoofs. Okay, so what is this? Acral hyperkeratosis. So there are hoofs. So there is acral hyperkeratosis. So the hands and feet become very, very thickened. Okay, and in the cow you will see some, some growths coming like this. So what are these? So these are skin cutaneous tumors. So tricholemomas. So they have multiple tricholemomas. So there are multiple tricholemomas which can develop, and they have acral hyperkeratosis. Okay, so hand and feet becomes thickened hyperkeratosis. This is one thing that you have to remember. Plus, you can remember, I bet this person looks like a cow. I bet this person looks like a cow. So what is bet? They have high risk of developing breast, endometrial, and thyroid cancer. Okay, so I bet this person looks like a cow. So what is bet? Breast, endometrial, and thyroid cancer. Okay, so remember which thyroid cancer is common in 𝗬𝗏 syndrome? Follicular cancers. Okay, so they have follicular cancers which are common. So I bet this person is looking like a cow, isn't it? This person is looking like a cow, isn't it? Now, very few patients of 𝗬𝗏 syndrome also have a big head. Okay, so a cow can have a big head, isn't it? So they can have macrocephaly. But macrocephaly is a predominant feature of Bunyan syndrome. So Bunyan syndrome, usually, what are the two important features? They have macrocephaly, the head is very big, and they have penile macules. Okay, so they have some pigmented freckles or pigmented macules on the penis. So that is the another feature of Bunyan-Riley-Равабака syndrome, right? So BRR syndrome. And what is the difference between 𝗬𝗏 and Bunyan apart from the clinical features? See, 𝗬𝗏 syndrome na hamesha बड़ों में होता है. So it usually occurs in the adults. Bunyan syndrome usually occurs in the neonatal life. So that is the difference. So they occur in neonates. Okay, so this is usually a condition which occurs in the neonates, and 𝗬𝗏 usually is an adult cow. So it occurs in the adults. Okay, so that is in adults. And both of them have which mutation? Remember, it is P10. Okay, which is present on 10q. Okay, so 10q. So P to nahi hoga kyunki P10 hai. So that's why. So they are present on 10. So that is the 10. Okay, so they are present on 10. So that is what you have to remember here. So that's your 𝗬𝗏 syndrome, which everybody should be very, very clear. Now, once we are clear with this, so everybody's clear with these two syndromes. So first we have studied about hamartomatous polyp syndrome. We have 𝗬𝗏 and Bunyan-Riley-Равабака syndrome. I hope everybody is clear. So 𝗬𝗏 is always in adult. Bunyan is always in the neonates. Difference in the clinical feature, Cowden is pre-malignant. Now the MCQ that they're going to ask you, okay, so they can ask you this, okay. So although this is a Hamartomata polyp syndrome, Cowden syndrome never give rise to colon cancer. That's very rare, okay. So Cowden syndrome usually never give rise to colon cancers. वो नहीं होते Cowden में. So that is one feature that you always remember. So they can give rise to breast cancer, they can give rise to endometrial cancer, they can give rise to thyroid cancers, but usually they will not give rise to colon cancers, okay. Apart from that, remember they have a lot of skin appendageal tumors like trichomoniasis, and they have acral hyperkeratosis. So that's a very typical feature of Cowden syndrome. And Bunyan has penile lesions, okay. So that is another feature, and they have macrocephaly. The head is big, okay. So you have to be, if you have to sit on the Bunyan tree, your head has to be big, okay. So that is your Bunyan tree, right? So that is first Hamartomata polyp syndrome. The second Hamartomata polyp syndrome is a very interesting one, okay. So this is called as 𝗂𝗃𝗃𝗃𝗃 syndrome. So 𝗂𝗃𝗃𝗃𝗃 syndrome is a story of a doctor who wants to go to Canada. So doctor who wants to go to Canada and there is no familial support. That is, this is non-genetic, okay. So it is non-genetic. So there are no strings, okay. So there's a big string here, no strings. So there is no gene which is involved here. So there is no gene. So this is a sporadic tumor, okay. So this is a sporadic lesion, okay. So there is no genes which is attached. Now a doctor who wants to go to Canada, he doesn't have money, no genes. What is going to happen? He's going to work very, very hard in the sun. So what is going to happen when he works so hard in the sun? His skin will get pigmented. Obviously, when he'll go to Canada and he has to work so much, his age will usually be more than 55 years. So he'll be old person now. His age will be, he's an elderly person. So he's elderly person. And he will also get the hair loss. So he has got alopecia. Hair is already gone. Okay, skin is already pigmented. And because he's working in the sun so hard, so in Hindi we say नाखून घिस घिस के काम करना. So he's working so hard, so his nails have become dystrophied, okay. So there's a lot of nail dystrophy which is going on. So they can show you this as a case also. A male presenting with alopecia and nail dystrophy. Which syndrome? Along with the Hamartomata polyps in the intestine. So what syndrome are we talking about? So everybody should remember, okay? Everybody should remember this is your non-inherited syndrome. So this is what is called as 𝗂𝗃𝗃𝗃𝗃 syndrome, okay. 𝗂𝗃𝗃𝗃𝗃𝗃 syndrome. It's a non-inherited syndrome which all of you should be remembering. So usually occurs in elderly. Look at the age of the person. He's an elderly person with Hamartomata polyps. So this is 𝗂𝗃𝗃𝗃𝗃𝗃 syndrome. Okay. Apart from that, what is the other Hamartomata polyp syndrome? So we have studied Cowden, we have studied Bunyan-Riley, we have studied 𝗂𝗃𝗃𝗃𝗃. Now the third is tuberous sclerosis. So tuberous sclerosis is like tuberous sclerosis. So tuberous sclerosis has which type of polyps in the intestine? They are Hamartomata polyp. This is what you have to remember. So they all have Hamartomata polyp in the intestine. And the third thing you have to remember, that they have very unique tumors. So tuberous sclerosis patients have very unique tumors. So if we talk about heart, they will have rhabdomyoma in the heart. So which is the tumor which is there in the heart? And then rhabdomyoma. If you talk about the kidney, in kidney, they will have angiomyolipoma. So there's unique set of tumors which occur in these patients. So that is very, very characteristic here. So that is about your Hamartomata polyp syndrome. So the pointers that we have remembered here, okay, so the pointers that we have remembered. So this is the chart from the Robbins, which is must to read. So just to recall here, so can you see what you studied? So you have studied juvenile polyps here, usually occurs in less than 5 years of age. The mutation that is there is SMAD4, BMPR1 and TGF-beta pathway is activated. So these juvenile polyps are usually present in the rectum. That's most common. Okay. Apart from that, they can occur at other sites also, but they usually have AV malformation and clubbing. Then we studied the second one, 𝗬𝗁𝗃𝗃𝗃 syndrome. You studied that it occurs in 11 to 22 years of age. Okay, and the mutation is STK11, and the new pathway that you studied, which is very important, that is AMP kinase pathway, which maintains the anabolic metabolism. You studied that the typical location of 𝗬𝗁𝗃𝗃 is J, that is jejunum, and they have pigmentations of the macule. And you know, screening has to be started at birth for sex pod stromal tumors of the testis. Okay, so they both of them can give rise to colon cancers. Both of them can give rise to colon cancers. Now look at the Hamartomata polyp syndrome again from the Robbins. We have studied this. There is Cowden syndrome and Bunyan-Rili-Ravabaka syndrome. We've studied that this usually, both of them, Cowden and Bunyan, are because of PTEN mutation. So whenever there is PTEN mutation, it leads to overactivity of PI3 kinase pathway. That's a very typical feature, which we will study in 𝗂𝗃𝗃𝗦 when we studied that. And usually these syndromes, Cowden syndromes or Bunyan syndromes, they usually have a lot of non-neoplastic as well as neoplastic lesion. In non-neoplastic, they have skin tumors, that is trichomonas. And you say, I bet you can have breast cancer, endometrial cancer, and thyroid cancer. So they have breast, endometrial, and so there is benign skin tumor, that is trichomonas. Apart from that, there is breast, endometrial, and thyroid cancers. Okay, remember I told you very importantly that Cowden syndrome never has colon cancer. So there is no increase in GI cancers. They do not have colon cancer. That's a very typical feature of Cowden syndrome. Always remember that. Okay. Then we had Ronco-Knight-Canada syndrome, which you studied. And you studied that this usually occurs in a person more than 50 years of age, elderly person. It's non-hereditary. The patient typically has a very typical feature, that is nail atrophy, the alopecia, and hyperpigmentation of the skin. That's very characteristic. And these usually have a poor prognosis. Obviously, he's elderly, he's going to die. So it's fatal in up to 50% of patients. And then the last one we studied is tuberous sclerosis. You know that this is because of TSC1 or TSC2 mutation. Hamartomata polyp are there. But there are unique tumors that occur in this patient, like angiomyolipoma, rhabdomyoma in the heart. And that is all about your Hamartomata polyps. So is everybody clear with the Hamartomata polyps, guys? So that is your Hamartomata polyps, which everybody should be super clear, super clear. So which Hamartomata, what is this? This is your brownie points. So which Hamartomata polyp does not give rise to colon cancer? So which Hamartomata polyp does not give rise to colon cancer? The answer to this question is Cowden syndrome. So let me see how many of you answer this. Yes, so that is Cowden syndrome and Bunyan-Rili syndrome. Okay, so this is just a table from the Robbins which I showed you to revise it. Okay, so that when you read your Robbins, you know what you have studied, and this chart is no more difficult for you. I hope you remember the image. Whenever you are seeing that cystically dilated glands, it is juvenile polyp, and when you are seeing the arborizing muscle in the polyp, you know it is a 𝗬𝗁𝗃𝗃 polyp. Okay, so with that, I'm sure all of you are clear with the Hamartomata polyp. Right? If there is any doubt, you can answer. Very good, Anusha. You get a chocolate. Okay, you have answered this question perfectly. Good. Okay. Right, guys. Anything else that you want to ask now? You can ask now, or yes, or we can leave the session. So I hope you've understood the session. And if there is anything else, I'll be happy to solve it out. Perfect. Thank you so much, guys. Thank you, Anusha. Thank you, 𝗏𝗏𝗃𝗏, Saint or Sinner. Okay, Saint or Sinner, I will request you to see the new QRP which is being recorded. Okay, so you can see the new QRP which will be out. If you want to prepare for your INI-CT, I will give you the list of topics which you should revise. Please message me on my WhatsApp. I hope you are in my WhatsApp group. I'll send you the list of topics that you should study for your INI-CT. That is must to read. With that, we will close the session. Bye-bye, guys. Okay, right. Hey, bye. चलो चलते हैं.